Okay, so basically today we're gonna talk a little bit about healthcare in Poland. So to start from beginning, we have a lot of different names that some of them might sound familiar for you if you stayed here for a couple months or even years. But sometimes it's quite complicated to start our journey with Polish public and private medical system. So to begin with, I guess the most basic thing is what NFZ is, and this is National Healthcare Fund. So if we want to go to public healthcare institutions or doctors or nurses, we should be insured in NFZ. So first of all, we have obligatory insurance. I'll talk a little bit more about it in a few seconds. And then, of course, if we don't have obligatory insurance, we can also have voluntary insurance, which I must say I would recommend for everybody because I guess even when you have some tax or any other way of having private healthcare in Poland, it doesn't cover everything. So if you are admitted to the hospital, public hospital, and like 99% of hospitals in Poland are public. If you're admitted in there, your private healthcare, even if you pay for that, doesn't cover any of the laboratory tests or imaging or any other treatments you will get in the hospital. So, who has obligatory insurance? Everybody who has employment or civil contract. In Polish, this will be umowa o pracę, this is employment, or civil contract is umowa zlecenia. This is very important because there's also something called umowa o dzieło, so contract work. And if you have this way of contract, this type of contract, you won't have obligatory insurance. What's more, farmers and their families, owners of business activity, so self-employed people, also those who are retired or old pensioners, students and preschoolers, and people getting social benefits, such as, for example, mothers on maternity leave. Those who aren't included in all those groups can consider voluntary insurance. There is a short instruction on NFZ website how to do that, but it is in Polish, so it's kind of complicated for some of you who doesn't speak Polish or at least doesn't speak Polish that well. First of all, we start with filling the form. You can download it from NFZ's website. The first part is just basic information about you. So number of passports, your nationality, date of birth, your address. Then if you want to have any family members, such as kids, your husband or wife, parents insured with you, you can also declare them in the same form. Then you declare that you are not covered by obligatory insurance, and you just sign it with your name to say that what you wrote is true. Then when you have the form filled, you have to prepare your ID. First of all, if you had previously obligatory insurance, you should prepare any proof for that. So, for example, employment contract, civil contract, document for self-employment, the document that you were unemployed and covered by the unemployment office, that you were covered by your family member or by school or university. Or that were, for example, covered by obligatory insurance in other European Union country. Then to prove your ID, so probably in most of the cases, this will be your passport and one of the following documents. So work visa, temporary or permanent stay permit, long stay European Union resident stay permit, resident permits for humanitarian reasons, tolerated stay permit, or refugee status document. Of course, one of them just depends on what you have. Then you can go to NFZ's office. So the place where it is quite near football stadium in Poland, in Poznań, sorry. The tram stop is called Węgorka, and then just opposite of the tram stop, you will have NFZ office where you can go with your ID and the form. What you have to pay monthly is around 500 zloty per month. Each year it is changed, so you have to check if for next years it will be also up to date. Sometimes, if you weren't insured before, you will have to pay some additional payment. Sometimes the amount of the payment is quite high, up to 10,000 zloty. So it is quite important first to get informed if you have to pay something or not. And then you will go to another institution in Poland, which is called ZUS. ZUS. This is short for Zakład Ubezpieczeń Społecznych. So this is the place where any social insurance is covered, is paid, and organized. So after you declare yourself for voluntary insurance in NFZ, you have to go to your local ZUS. You have 7 days for that, and then you will have another form to fill. You can obtain it or in your local ZUS or on a website. And there's a code for insurance. If you have voluntary insurance, this is the code 2410XX. This is how it looks like. It's quite complicated, but mostly what you have to fill in the first part is your basic information again. Then this code, here it's mentioned once again, your address, and some additional information. So if you have any right for pension or retirement in Poland, and whether you're disabled, and if yes, what kind of disability you have. So in Poland we have 4 levels of disability for paperwork, of course. So from mild to disability, which complicates everyday living, and the 4th level is just for young people up to 16 years old. And then of course you have to pay to sign it to confirm what you've written is true. And each month you have to fill a form and declare it in ZUS and pay your monthly contribution on your individual account. You will get this account number after you will go and fill this form. If you have declared any member of family, as I said, children, both adopted and biological children, your husband or wife, or parents, you have to submit also another form for them. You can also get it from website or in local ZUS. So your proof of insurance is this agreement you will sign with ZUS and the proof of your last month contribution that you paid it. For family member, those 2 and this additional form I mentioned a second before. And of course, you have to have your ID, for example, passport. Normally, when you go, for example, to hospital or to your GP's clinic, you don't have to have your proof of insurance with you. But sometimes, computers can be tricky, and when the information is lost, it's sometimes better to have it with you, or at least to have someone who can, for example, scan it for you and send it to you. So this is not only about healthcare. So you have additional insurances such as retirement insurance, pension insurance, sickness insurance, and accident insurance. So retirement and pension insurance. Retirement is something you get when you're old enough and you can stop working after a certain age. And pension is when you cannot work because of your health reason, and it's permanent. So obligatory retirement and pension insurance, you get it when you're employed by contract, you have commission agreements, agency agreements, you have home-based work, you're self-employed, or you work in agricultural cooperatives, people on parental leave or obtaining maternity allowance, people who stopped working to take care of your chronically or severely ill family member. It's also kind of bureaucracy procedure. So it's not just that you declare that you stay home with your mother, for example. You have to declare it officially that you stop working and you will stay with them. And in the situation, you're often obliged to fill some forms, but you will be allowed to get some care benefit or allowance for caregiver. Also, what's more about obligatory retirement and pension insurance? Unemployed people who are under the care of local employment office, people obtaining sports scholarship or during post-diploma studies, and all people connected to any religions, so priests, monks, nuns, etc. When you're not in any of those groups, you can be voluntary insured. You need to fill another form, of course, and then the title for insurance is 1900XY. It's for this year, the minimum what you pay is 770 zloty. Sickness insurance is something you need when you're sick and you have employment contract or you work in agricultural cooperatives and you're on sick leave. Then ZUS pays you some money for the time you were on that sick leave. Normally it's 80% of what you normally earned. So as I said, obligatory for employment contract and agricultural cooperatives. Also for PhD candidates, religion connected people, on commission agreement, agency agreement, home-based work, and self-employment. And if you have also obligation to pay retirement pension contribution, you need to report yourself for sickness insurance in 7 days. So it's kind of connected. Accident insurance is non-obligatory or it's not used for people who are unemployed. They work home-based, they're on parental leave or on maternity allowance or during annual vacation. This is connected with what accident insurance is because you get it when you have accident during working or on your way to or from work. There are also some non-national insurance systems. Most classical one is PZU, but there are many companies that organize those private insurances. And sometimes you can see some types of those insurances are, for example, against the risk of accident. When you get covered your cost of treatment, rehabilitation, you get some compensation, you have paid incapacity for work, you get money when you have serious illness or death or disability. You can have covered healthcare, but it's private healthcare. Remember about that. That's not the same as NFZ and ZUS. Then non-medical insurances. So for drivers, there's OC, obligatory for each vehicle owner, and AC is voluntary. It's whenever you have car accident, for example, and even if it's your fault, you get some money to cover any problems with your vehicle. And financial insurances, for example, for house, against theft, and travel. When you travel, sometimes you need also insurances. The most common is luggage and healthcare, but sometimes also transportation, corps included. So sometimes when you go for a dangerous trip, it's also quite important. Additional retirement plan is something that you pay and is added to what you normally get when you're retired, and some investment insurances for companies. Then you have private healthcare by private companies who sell some kind of packs of healthcare options. So those two are the most popular, but there are many more. And what is covered by those? You will have in some packets, you'll have emergency help, some specialists consult, some lab results, some imaging, sometimes dentist work also. But it's quite important to check what's included in your pack, because not every pack is as good as the others, and not all of them cover enough for you. It's very popular among big companies to cover it for their workers. So sometimes when you work in a big company, you can ask if they have that option, and that can be a nice addition to what you get from public healthcare. What more about private healthcare? We have private laboratories. Those two are chains of laboratories, quite popular. Those places are when you don't have referral from your GP, but you want to have some lab results done. You go there, you pay, you have blood or whatever you need taken, and then with a simple lab test one day, in more complicated in a few days, you will get your results. You can check them online mostly, and in most places you can also pay for them online beforehand. There's also search engine for physicians, but not only, sometimes also dietitians, physiotherapists, called Znany Lekarz, where you can type the specialization or the name of the physician or healthcare professionalist, and the city, and you can find some options you will have. So for example, here, some doctor, you will see that opinion about this person. So you have 5 stars for this person. Then you have comments. You will have information about where this person works, sometimes also a phone number or email address. And some of those have also an online calendar for the consult, where you can just click and reserve an appointment for yourself.